We're talking with Dr. John Augsburger, biological dentist at biodentist.com. So, Dr. John, I have a root canal or two, so what should I do now?
The first thing that you should do is have x-rays to see what kind of damage is being done in the bone around that root canal, because it's true that some root canals are much more toxic than others. So it's important to identify which root canals are the most toxic, and the bottom line with a root canal is they are all toxic, but it's not always the best solution to take all of the root canals out at once. So that needs to be figured out. The second thing is, in all circumstances, when patients come to our office with root canals, we always recommend removal of the root canal because of its toxicity. But what's really, really important with the removal of a root canal is the protocol and procedures that are done at the time of the extraction to protect the patient and protect the bloodstream. So the body's job when there's a toxicity, and in this case a root canal, the body's job is to quarantine those toxins. In other words, to not let them run rampant in the body. And that's really what we see in the case of an abscess. Is an abscess is typically localized to the root canal tooth because the immune system is there working hard, attacking those toxins and those bacteria and fungus that come out of the root canal. We need to protect the body through the removal of the root canal. And how we do that is a number of different ways. Number one, being the most important, is intravenous vitamin C. We want to provide the body with a massive dose of antioxidant during the toxic event of removing the root canal. Because when a root canal is removed, that's a physical back and forth amputation procedure that releases many, many toxins into the blood at that moment. Those toxins, if they're left to run rampant, cause the body to go into an acute inflammatory state. And having the vitamin C there is a way of neutralizing those toxins so that the body doesn't have to deal with the toxic event of having a root canal tooth pulled.
So that means that removal of a root canal tooth has to be done in a very special way, or you could get even sicker.
Very true, yes. And that's where the vitamin C comes into play. We also like using ozone, which is a reactive species of oxygen, to help neutralize or even kill the pathogens, not only in that area, but in the bloodstream. And we also like to use trauma homeopathics to help the body manage the trauma of the physical removal of the tooth. And we also like to use enzymes to manage the inflammatory response and to help break down inflammatory biochemical substances that are in the bloodstream. Enzymes can really help with that.